With that subject, with COVID-19 numbers surging in Gauteng, there are concerns that not enough people have been vaccinated. You heard there our colleague Griselda Lewis talking about 8 million people in Gauteng who are still yet to vaccinate. Calls are mounting for those who are still hesitant to get vaccinated to do so. But will this call be heeded? Let's talk to Dr. Aslam Dasoo, who is the Progressive Health Forum's convener and joins us live now. Dr. Dasoo, it's always a pleasure to speak to you. Listening to what the Premier of Gauteng says, that we are at the cusp of the fourth wave. Do you get a sense, though, that we're still at the cusp, or are we there?
Good evening. Thank you for inviting me. Look, I think to all intents and purposes, we are there. There's very little doubt that the current upsurge is the beginning of the fourth wave. We are still in the early days of it. And that may, indicate or rather have an impact on how we reading the numbers. But clearly, the increase in the number of positive cases leave us in no doubt that we are in the fourth wave. Yes.
Now, when one looks at a lot of concern being raised around vaccination and the number of people that have still not taken this up, of course, the numbers have been going up, as the Premier in Gauteng has said that he's seeing an increase. But is this enough to cushion the blow of the fourth wave?
Yes, I think it is, because, look, our vaccination rates are still desperately low, certainly for where we should have been in terms of the target set and in terms of the amount of vaccines we have in stock. There's some 16 or 17 million doses in stock, in fridges, not in arms. And there's been a downturn in the uptake of vaccination. Now, there's a whole debate to be had about that, but it is what it is right now. And our rate of vaccination at this point just puts us at about over 35% of all adults being vaccinated. And we were planning by the end of this year to be close to 80% of that group. That would have had a tangible effect. However, the reason, and I must agree, that we are probably seeing a lag in the number of admissions as compared to the number of cases when compared to the third wave at about the same time, may well be because there has been a huge amount of natural infection in the country and in the province as well, which does confer some immunity. And of course, vaccination, as slow as it is, has been going up. So with those factors in place, I think it's fair to say that our hospitalization rates are fortunately less than our case rate. However, I would also caution that it's early days, that people who are infected take 10 days to 2 weeks if they are going to get sick and need hospitalization to actually present. So I think we need to watch the space for the next couple of weeks. Hospitals need to be ready, and I think that message has gone out. We've been in this for 2 years already. We've learned, we've had the experience. And there's nothing totally surprising. There's a predictable pattern. We know these surges are coming, and when they are coming, this surge has occurred slightly sooner than we expected. And that's not surprising, because we had this very big event, the elections. And, typically after 2 weeks, we did start to see the uptick in that. There's, of course, the problem that this is the festive season with a lot of gatherings. And if there's one thing that's going to shoot the numbers up, it's gatherings. And unfortunately, it is a time when families want to be together, friends want to be together, and the COVID Grinch has once again visited us.
Listening to what you're saying and what some officials have been saying, especially earlier today when I was watching that command council briefing by Gauteng, some officials, especially the Premier, seem to think that because of, people have been vaccinated and the hospital admissions are low, we may not have it as bad as we did in the third wave. But I'm listening to what you're saying, that may not necessarily be true.
Yes, that's correct. And I think the Premier, and bless him, because he wants to sound an optimistic note, which is always important for the public. However, I think, one must be realistic. that this wave is being driven by a new variant. Now, whether this variant is able to show a little bit more evasion of existing immunity is still being checked. But we do have a very strong sense that it's certainly spreading very fast. And the mutations in the new variant seem to be geared for that. Whether this will translate into severe illness and hospitalization at the same rate as we expect remains to be seen. And we'll know that soon enough. I think we must take the view that the hospitalization rates will be at least as high as they were in the third wave and prepare at that level. And, if we are fortunate that it's not that high, that's okay. That's just fortunate. But we have to be realistic. This variant, there's still a lot of information about it outstanding. As I said, in particular, its virulence, and that will have an impact on admission rates, for sure.
And when you then look at how fast it is spreading, would you then advise those who are in a position to be able to test before they vaccinate to do so?
Well, it's probably better if you have access to testing and if you're feeling ill, to test first before you vaccinate. And if you're positive, then, there are clinical guidelines as to how long you wait before you take your vaccination. However, I must make this clear. Being infected alone doesn't preclude the need for vaccination. Indeed, if you do get infected, and even if you recover from that, taking a vaccine will certainly boost your immune levels to extremely high degree, and will prevent you from being infected again. And you can get infected even if you do take a vaccination, because vaccines don't prevent infection. They just prevent you from getting very ill. And so you might still get the bug and be able to transmit it. So we are in this interregnum, and I think all the rules that we've learned must apply. And in particular, the rules around non-essential gatherings. We've seen these school leaver festivals being cancelled. It's unfortunate, and one feels for the parents and for those who've paid money and now may lose that money. But it's not something that came as a surprise. The only surprise is that the authorities didn't prohibit these things in good time, because it was certain that there would be spread out of these. We saw last year from these events, they became super spreader events, and with the beta variant, just drove that second wave dramatically and horribly. And we should have planned for that now. I know it's hard. We know that there are many informal gatherings of these school leaver events in suburbs, in townships, involving thousands of people. So I don't think we're going to be able to get away from it. I think it's going to drive infection, which is another reason for caution about what we're predicting in terms of admissions. But the authorities have to do everything they can to avoid these non-essential gatherings at this stage.
And very briefly, Dr. Dasoo, as we wrap up, one of the concerns, though, is also around the people that have taken the one jab and have not gone back for the second jab, because this is a huge concern here in Gauteng, numbers at over 760,000.
Yes, very much so. Your first dose of the vaccine is insufficient. And you must, as soon as you can, take the second dose. It's available and you should do it. I think the issue really now that faces the country is that with low vaccine uptake and plenty of vaccine in stock, we need to do everything we can to encourage vaccination, including, as the president said, considering vaccine mandates. These are not anything to be afraid of. They don't take away your rights. You already use vaccine mandates when you vaccinate your children because they can't go to school without it. And you take vaccinations when you travel into certain countries, and you do so quite easily. And health workers take hepatitis shots and so on. So these mandates shouldn't be seen as some kind of bogeyman to abrogate your rights. No, indeed, this is for the public good. You should, and if we do need to put in mandates to increase the uptake, then that's what the government should proclaim as soon as possible.
All right. Thank you so much for your time, Dr. Dasoo. It's always a pleasure to talk to you. And one of the very important conversations around those people that have yet to go back for their second jab, as you hear that Dr. Dasoo saying that it is very important that if you've taken your first dose, you must go for your second one. On the other side of this, we look at the issue of vaccine mandates, as you heard him there talk about the difficulties and also some of the intricacies around the